things happen in clinical practice, it's always about first doing a check-in. We always start with a mindfulness activity to really get everyone sort of our nervous system's regulated and on the same page, and then go from there, be it with the structured activity or
Yeah,
riffing based on what the trainees need. And,
that's amazing.
we designed this such that these skills are for first and foremost for the learners, for the healthcare workers who are learning the skills. But some of them are really transferable to clinical practice. So the secondary goal is that as doctors, we can actually use some of these skills with our clinical teams, with our
Mm,
patients. So, for example, signature strengths and character strengths identification is something I do with most of my patients, both adults and children. And I'm actually building out a broader intervention currently in fellowship to teach this character strength skill to child and adolescent clinicians in our state
wow.
system. So, I love teaching these concepts, and I think that there's so much relevance in clinical practice, both for ourselves and our well-being as clinicians, but also to really augment the toolkit we can use with our patients to focus on more than just what's wrong with them, but
Right.
really what's working and what's right with them.
Absolutely. Because there's so much to talk about there. I could
Mm.
pause, right? Because yeah, we're focused on, symptom reduction or treating the disease. And, how do we, you mentioned a couple of times language, using language and so forth. And
Mm.
so how do you use language and practices from that program? And you said you're building this out in your current practice.
Yeah.
How do you move people? Because I'm imagining you're looking to implement something that's moving people towards more growth and meaning,
Yeah.
purpose, like you talked about, right? So yeah, tell us a little bit about that, and then I'm gonna have to pause, and Jeff and I are probably gonna have like 20 minutes of questions. So,
Yeah.
so